Hello everyone. Today I want to explain the sepsis, specifically the clinical manifestation, and the pathogenesis and the pathology will be discussed in the next video. So first of all, the sepsis definition is what? Now first you have to understand that maybe a patient will get bacterial infection. 90% of the patients who present with sepsis, maybe they would have bacteria infection, or less commonly fungal infection, which more can be seen in immunocompromised patients like diabetes mellitus and other HIV and other things. And lastly, viral infection, which is very rare. Okay, now if you have the infection, there will be, normally your host response, WBC will try to kill this pathogen. But imagine that there's something wrong with the system that leads to excessive host response. So instead of this, your body cell, like the white blood cells, instead of helping you, they are starting to kill you instead of helping you. So there will be excessive host response. The host factors will lead to cellular damage, and then there will be organ damage because organ is made up of cells, and then there will be death of the patient. Now this is the etiology, and the pathogenesis I will describe it in another video, but for now, to understand, there will be what? Acute inflammation. This is here, you can see that this is the infection lying here. There will be tissue destruction. These WBC are trying to go there. So what they will do, first of all, the mast cell, the macrophage will produce cytokines so that this PMN, which is polymorphonucleate, to come, will send it to come. But what will happen? There will be vasodilation, leakage, and all of these factors will lead to what? Hypotension. Now, instead of this localized infection, this response, which is the vasodilation, will be systemically, and this is the key behind sepsis. And the list now, if there's of course, if there is generalized vasodilation, generalized hypotension, hypoperfusion, organ damage. Okay. Now, what are the risk factors? Now, have you ever asked yourself, well, like everyone will get sepsis after getting this simple bacterial infection? Well, no. So there are some, like there are some risk factors. Okay. Now, not every person who's having infection will get sepsis, and not every person who's having sepsis have this risk factor. So this is just a risk factor, increase the risk. So anyone can get, also a healthy person will get sepsis. It's okay, but we don't know. So this is just a risk factor. Elderly, patient who's having liver disease, kidney disease, any organ disease, chemotherapy, very important, chemotherapy, because it leads to neutropenia and decrease of the immune response. Immune response. And here you will have patient, this is holding chocolate, so he's having diabetes, and this is the respiratory syndrome, because respiratory disease, because you can see this this is just like an asthma medication. Now, how you can save life? So the key behind sepsis and managing sepsis is early recognition and prevention, and we will talk about this later. The prognosis depends on you. You are the doctor, and you will determine the prognosis. Early treatment, better outcome. Then, so let's start with the symptoms. So there will be sepsis. S standing for shiver or fever, or the patient is feeling very cold or very hot. Why? Because as I tell you, as I will tell later, that the temperature might be high or low. Okay, so some patients will present with hyperthermia, some patients will present with hypothermia. Now, particularly those who are immunocompromised. Then E stand for extreme pain, P stand for paler, and S standing paler because of this is like in late stage there will be vasoconstriction, but early there will be like arrhythmia, pain, redness, flushing, the sign of acute inflammation. S sleepy, confused. I, he will tell you, I feel I'm dying. S shortness of breath. Yeah, later. Now this is the symptoms. Okay, sorry. The sign is the physical examination. Now you are the doctor. What you will see now? These symptoms, the patient will complain. He will tell you, I'm doctor, I'm feeling very tired, and. But you We'll do the physical examination. You will see, look, A, B, C, A, B, C, D, E, F, G, okay, A, B, C. Now, because this is a 3, so I'll put 3 here and then D, okay? So I'm trying to let you remember everything. That's why I'm giving you mnemonic, okay? So A standing for acute altered mental, and we said why. What is the pathogenesis behind this? Well, remember, cytokines will lead to vasodilation. Vasodilation will lead to hypoperfusion to the brain, and that's it. They will get to the altered mental status. B standing for a low blood pressure. Now, blood pressure is tricky. Early treatment, early in the disease, there will be high blood pressure because of the stress. There will be glucocorticoid, everything will be secreted, like epinephrine and. But later on, everything will be compromised. Low blood pressure. Okay, so here we will be systolic less than 90 and mean arterial pressure less than 65. C standing for circulatory insufficiency, cyanosis. Why? There is vasodilation of the systemic blood vessels. 3. TTT, tachycardia more than 90, tachypnea more than 20, temperature 38 or 36 as I mentioned. D standing for DIC. Well, why? Because we will talk about it in pathology better. And here, liver dysfunction. Why? Vasodilation, less blood supply, jaundice. Okay, good. Now, temperature, tricky. Why? Because immunocompromised will present with 36. Some patients will present with 38 and above. Okay. Now, well, doctor, see, where's my septic focus? Why you want me to see? Well, to remove it. Okay, if I have patients who's having chemotherapy, of course you will have this central line, for example. So you will remove the central line. Maybe if the sign of infection coming from the central line. Later on, you have septic arthritis. If the patient is having swelling in the joint, you have to see maybe this is still infection, so you have to remove it. Then diabetic foods. So maybe you will do remove the abdominal tissue or amputation. And infective prosthesis, well, you have to remove the prosthesis, otherwise the patient will die because of this prosthesis. Okay, now this is the additional one, like for the chest x-ray to see if there's pneumonia, abdominal ultrasound, if there is any swelling and other things. Echo for maybe bacteria endocarditis of the heart. Okay, now let's go to the lab. Okay, so let us take the sample. The most important thing is to take the blood culture before administer management. But if you cannot take the blood culture, the sample for blood culture, which is blood sample, in this case you give the antibiotic. Okay, but it will be false positive or false negative. You have in the management later on, it will be confusing. So it's better to take the sample, then you give the drug. You take blood CBC, of course, urine if needed, and for testing for the kidney function. And here, if there is any swelling in the joint, you take this, aspirate the fluid, and the stool if there is any GI symptoms and other things. So this is not always, if clinically indicated. CBC, and I will look for WBC. Okay, sensitive marker but not specific. Why? Because some patients will have neutropenia and immunocompromised in chemotherapy, and some patients will have neutropenia. PCT, which is basically procalcitonin. This is a very important marker for bacteria, sepsis, and lactate dehydrogenase. We will talk about it in pathogenesis. And you have the inflammatory marker, and last thing, which is not specific, okay? And the sign of organ dysfunction, like ABG, arterial blood gases, metabolic acidosis, and urea creatinine for the kidney, and you have liver functioning test, and INR and APTT for looking for coagulation disorder, like in DIC, disseminated intravascular coagulation. Lastly, look, every delay in your management, there will be a decrease or the rapid decrease in the survival rate by 10%. So in the first hour from the initial presentation, not the initial presentation for you to you, no, from the initial injury. Okay, so depend on the patient also. If you come early, you will be able to control the prognostic factor. If you come late, finish. Every hour you lose every hour, you cannot help the patient, because there is stages of shock Okay, the patient will enter the shock, and we will talk about it in pathology. Now, for the management, please remember you have to give, first of all, take the blood sample, then give broad spectrum antibiotic fluid, okay, and then you take also, you can give supportive therapy like blood glucose, managing the blood glucose by giving insulin and vasopressor, okay, for the blood vessels, and lastly ventilation if needed. Okay, and I will post this picture. You can make it capture, and I will try to put this like this A3 every time I explain for you, so you can memorize it if you want. Okay, and thank you so much.